Hey everybody, it's David. What we know is that innovations outside of healthcare have to be adopted by the healthcare industry to meet some of the challenges that we're facing today, especially for our provider community. That's why I'm excited to have Oosto on the podcast today. You're going to meet Patrick Welsh, GM of Americas. You're going to meet Avi Golan, CEO of Oosto. And then you're going to meet Ryan Logan, the president of NextGen. We're excited for this conversation. You're going to learn a lot about the challenges that our providers are facing, the solutions that are now available, and then the benefits that come from those. Avi, thank you for being here. I'd like to start with you. Tell us a little bit about Oosto and what you're doing to help provide a needed solution for our provider community.
David, thank you for hosting us. It's a pleasure to be here. So Oosto been around the block for almost a decade. We've been founded at the notion of creating a better, safer world by leveraging AI technologies. We've been advanced to the market for a long time, but we will continue to develop algorithmic capabilities, software solutions for many type of industries around the world in order to create a more safer environment, security applications, safety applications, industries like gaming, like transportations, airports, train stations, public events, public environments, everything related to identifying, detecting threats, and eventually even predicting capabilities to allow us to provide better, safer solutions.
It's a big deal in healthcare. The large majority of healthcare violence events happen in a healthcare setting. And so the solutions that you have brought to healthcare and other industries is a needed one. And I'd like to ask the rest of our panel, why is it so important in healthcare? What are the challenges our providers are facing today that makes this such an interesting and important topic?
So from a safety and security standpoint, can you think of a facility or building that should be more of a safe zone than a hospital, right? Well, you would think that, but a lot of these hospitals and institutions in healthcare, they have big challenges based on maybe their location. These inner city hospitals face challenges every day with homeless, gang members, especially in the ER departments. Nurses and doctors don't feel safe. So with a product like Oosto, in addition to all the other technologies that we provide, like card access and video, Oosto brings something new to the table. It's a very proactive approach to avoiding bad things that could happen. We've seen now over the last year, many of our hospital clients are looking at putting in and have implemented weapons detection. So that's also, helping with the proactive approach. But when you talk about hospitals and Oosto, being able to identify known criminals in children's hospitals, especially the pedophile challenge is huge. With homeless people, being in hospitals, their algorithms can let us know, obviously not who the homeless person is per se, but that there are homeless people sleeping in areas that they really shouldn't be and things of that nature. So it's really been a proactive approach across the board. As you'll hear the guys from Oosto here talk, there's probably no better case studies than what they have on in the gaming industry. But how cool is it that we're taking a technology that really you think of the gaming industry and using it to protect hospitals and health institutions against all those challenges I just mentioned.
So we to enhance on what Ryan was saying, we already provide several solutions, but we see the healthcare industry as something that is going to evolve with the use of AI technology. So examples that we have today are not necessarily only security, but also user enhancement. So we have hospitals that using us in order to provide access to protected area by only individuals that have the access to that.
Sure.
You have clean rooms or operating rooms that could not really touched by readers, card readers, and needs to be using face or your biometric in order to enter them. We hear a lot about harassment that happens for staff, nurses and doctors that need protection against these either ex-employees or even relatives or ex-relative. There's so many use cases that can be used for security, but then you add to that safety element like detection of falling,
Right.
which is a major situation in not just hospital, but also in assisted living environment. That's area that what we can provide. And that's by the leverage of the technology that we develop over a decade of hard work.
Yep, very good points. So you have the visible and invisible, right? So Avi touched on frictionless access. For a doctor that's already scrubbed, you can frictionless walk into the ER where only that doctor and one or two nurses are actually certified and allowed to go.
Sure.
So you can't see the staph infection, which will cause sepsis and probably
Right.
be one of the largest issues hospitals deal with. So that frictionless access gives them secure access into that environment, protecting the safety of all the patients. Ryan touched on many different groups. If you go through every level in a hospital, if you're in the NICU, there's only certain people that can get in there, certain nurses, certain patients. If you're in the maternity ward, I need to know that those parents are the parents for that child and they are the only ones that are allowed in there, right? And the others that we were talking about, the gangs, right? That's needle in a haystack, right? This guy's coming in to settle some finished business. We already know who those gang members are that have been shooting each other. How can we help provide the nurses with a safe work environment? So, and it's unique. They're open 24/7.
Yeah, and what does a hospital have more of than probably anywhere else, right?
Drugs.
Right. So I didn't mention, people with addiction issues. The pharmacies in some of these hospitals are huge. So you have that as well. But I would say we do business with so many different verticals of industry. Oil and gas, healthcare, pharmaceutical manufacturing, transportation. Hospitals are probably the most challenging to protect. Why? Because they're open to the public 24/7.
And to anyone.
There's constant. I would say of all of our clients, we are on a healthcare facility more regularly, day after day, as an integrator and a service provider than any other industry out there, without a doubt.
Well, because of the visible versus the invisible, but also the external versus, the patient being a threat to themselves sometimes. You talked about fall protection. Falls within a healthcare facility are a big problem. And it's really hard to proactively anticipate, a patient being at risk. How is a solution like Oosto and these AI algorithms, how is that helping prevent a patient being a risk to themselves?
So there is two elements of that. Number one is, first of all, detecting a falling, right? Which is one thing, someone fall. Now you need to have the causation of that fall. That's usually used in a compliance elements that you want really to investigate the situation. And then there is the preventive. And the preventive is really to understand the environment and how really to address to prevent that. An example in assisted living environment is you see someone wobbling, right? Not really walking in a straight line. You can see it in every place, but hospitals, you can have drug dealer, whatever, but you can try to sense that and really apply some rules of how to detect this type of behavior and alert over time. AI can learn elements of that, can train the algorithm on the fly to really be able to better prevent and alert when things like this happens. And that's the power of the technology.
Yeah, it is. Speaking to the power of technology, the security risk isn't new to healthcare, right? This is something that they've been dealing with for a long time. But before these trained models and before this advancement in technology, how were providers, how were facilities managing their security before now? What was this looking like 10, 15 years ago? Even today in some facilities, I'm sure there's still spreadsheets involved somewhere.
Sure. And look, a lot of our healthcare clients have done a great job of doing everything they can to make their facility as safe as possible for their employees, their staff, and the people that are there as patients. We've been doing card access and video surveillance at these facilities for as long as I've been in the business, which I won't even tell you how long that's been. Most hospitals have taken a real good approach, but it's also, in some regards, a reactive approach as opposed to a proactive. And it's not they're not to blame there. There hasn't really been a technology that could be proactive in the way that like a Oosto can, right? This AI is cutting edge. It's doing things for the industry that have never been done before. So
I almost envision a few people in a room monitoring cameras. They have a few notes right from the shift before them. And they're probably looking at the notes and trying to match that to what they see. And then their shift ends and their notes get compiled with the other notes. And then the next guy comes in and has to catch up. And it's completely manual. But every step of the way, we're humans. We're error prone.
Yeah. We try to take as much of the human element out of, and not just with Oosto, with any technology we have in a hospital or any facility for that matter. The more human element you can take out of things, the better, if they're accurate, right? Yep. And Oosto, the whole reason I'm sitting here is Oosto being a product partner, solution provider for us, they do it better than anything else we've seen out there. We don't bring on a product partner very lightly at NextGen. We have product and solution providers calling us every week, wanting us to be a dealer of their solution, their product, their brand. And very rarely do we bring one on in this stage of our company's history, right? We feel we have the majority of the best in breed products. And Oosto just really blows away with the accuracy of their algorithms, and it's really amazing stuff.
Good points. The other thing is that the threat's emerging, right? You have a lot more because they're open 24/7, because the public is traversing. They typically stay for a day or up to 3. These aren't residents, right? These are people that they come and go like at a train station. So they have a lot of the common problems you'd see in transportation and other industries. They just now are dealing with it more. Threats from human traffickers. There are people coming into children's hospitals that are stalking and stealing kids. And it's a real problem. So, there are other industries that are dealing with that if we put the two together, they can learn a lot from how they've dealt with it and in many cases prevented it. But they're starting to deal with new threats they didn't have to deal with before.
When I think of, valuable assets, your family's one of them, is the biggest. But if you're thinking about the gaming industry, the amount of money that is at risk in their facilities, the amount of bad actors that have targeted those facilities, you can almost draw a one-to-one comparison between the gaming industry and the healthcare industry because of just the value that's being held in those facilities and the value of, those people and those dollars. What have we learned from the gaming industry that is a direct correlation to how we can identify these bad actors proactively, and regardless of how well the notes are from shift to shift between these human monitored systems, what have we learned and how have we started to apply?
So I would say that, first of all, I think it's the gaming industry. It's a very good test bed because the regulation, which is pretty heavy, but it's more relaxed on the use of the advanced technology. So that's where you can go and actually test that in live action in a very complex environment, right? The need for them to capture different personality, different types of people is also wide. The amount of people, the amount of cameras that are set to really detect is pretty high as well. So you run it over there. For us, it was almost like a great experimental place where we basically now 95% of Vegas Strip is powered by Oosto technology.
That's incredible.
Because we were able to prove that even in this very complex environment, we can make an accurate detection. And the emphasis on accurate. It's so important to reduce fault detections, to be very accurate, because once you cannot trust the system, you're gone, right? Because then you need to apply more people to look at the system. And I think hospital now can really take that learning, deploy, and they can see that I'm not saying that they can be completely autonomous. I'm saying that they can be much more autonomous using technology, using their processes and procedures and compliance elements, but leverage more of the tools that we provide.
And I think you're touching on one of the biggest challenges in the healthcare space for any partner, for any vendor, which is cost effectiveness, right? But also staffing. And I could see a solution like this helping solve, or at least help with both of those challenges. What have you experienced?
Well, I never really thought they were that much alike, but the more you think about it, they really are. They're both open 24/7. They're both completely open to the public. They both get people on a transient basis. They do have some undesirables. They have their frequent flyers thinking they're a soft target. And they both have security and a safe work environment as a mission critical need. So they have that in common. And they can take a lot of lessons from, even though it's one of our smallest vertical industries. People wouldn't think until they realize that they have a lot of money, they have a lot of different workers, they are viewed as a soft target, that they do need a system like ours to protect them.
Yeah. I can't think of a more secure location, maybe an airport, but casinos, they know when you walk in and when you walk out.
Yep.
And that's where we want to get to in healthcare.
And we did take some extra steps over the years to reduce that cost of ownership for the customer, to really perfect the algorithm to run on a low power devices. You don't need to really deploy lots of IT resources to maintain that. So over time, the technology advanced to a level that it could be affordable, even if you have lots of budget. But for me, I don't want the customer to think about how many cameras I need to connect to allow my budgets to fit into that. I want every camera to be connected and reduce that cost of hardware and ownership overall, so you can deploy it everywhere to detect alerts at the right time at the right places.
Flexibility has got to be important. In healthcare, we know a solution for one is a solution for one. Everybody's different with different challenges, different needs. How important has flexibility in the Oosto solution been to the provider community?
It's actually, in addition to them having the best accuracy we've seen, one of their other, the big benefits of Oosto, and I think Patrick, the first time he told me this, I said, come again? What was that? And it's because they allow you to move licenses from one camera to another. So if you own 5 licenses, they're not strictly dedicated to those 5 cameras. You can change them, put them on different cameras. For example, we use the K through 12 example all the time, right? I have 10 cameras with Oosto embedded on them during the day at all my entrances, but during a big football game, I can change those licenses to the cameras that are down around the entry or admission to the football game. And that is, I don't know that anybody else is doing that.
Yep.
It's a big feature of using Oosto.
It's a really good point. That we want people to have it deployed more and not have the money be the only consideration, because you look at the mission, they're trying to protect people, right? So what price do you put on that? And then after the fact, there's always money to go fix something, but not enough money on the front side to be able to do it. So we'd rather have you deploy more. When we look at frictionless access, giving our partners the ability to use this for access control and have the exact same system then protect you from those, people that would be on a watch list for the pharmacy, right? To be able to use the same system for both. That's the kind of flexibility that makes us unique.
What about hardware? I mean, when you go into a new facility, do they have to rip out their cameras, install new ones?
99% of the time, no. Oosto really is agnostic to any of the different cameras now. Now, if we run into a camera that's running on coax and is analog from 1997, we might have to do some hardware replacements, but you don't see that much anymore. Everybody's pretty much caught up and up to date on their camera technology.
I can imagine how important that is.
Oh yeah,
especially in hospitals where money is always tight.
Yeah,
exactly. And there is a return on investment here. We would work with any end user, not just healthcare, on how technology, and it's not necessarily Oosto specific, but technology it's always, security's always been looked at as a cost, right? It's a cost. I'm not getting anything out of this other than I got to spend the money, whether it's operating capital or a combination of both. And one of the return on investments that we were constantly looking at is how much can our end user save in manpower because of technology, right? So that applies to every vertical out there, right? So if done the right way, using Oosto along with other technologies, a hospital could save, I'll say, hundreds of thousands of dollars a year, less guards, things of that nature, or maybe redeploy those guards to do things that only a human body can do, and not sit and look at cameras, which we all know the stats on that. There's tons of human error in that.
Oh yeah.
Ryan, I was going to say, excuse me, he brought up a great point about, the work environment and safety. One of the things that we typically see in an unsafe work environment is that nurses don't want to work for you. So what does it cost to replace one nurse?
It's a great point.
My sister does a lot of healthcare recruiting, and it's very expensive to replace a nurse that doesn't want to work for you because you've not maintained a safe environment.
And there aren't just a whole lot of nurses out there right now. There's an incredible shortage.
Yeah. I would say from a flexibility perspective, we never work in a silo. We're very integratable to existing systems. So cameras is one, work on the existing camera infrastructure. You have other security solution, other access control systems. We work to really integrate to that in every open source mode, open API. So it will be a very seamless transition, replacing the old habits of, like you said, you imagining this guy sitting in a room taking notes. That's the element that we want to replace.
Right.
That should go away. Everything need to go to your mobile. You just need to see it over there. You need to sit and stare on computer, right? And by the way, the detections of AI can do a better job than the human eye, right? We know that.
Yep.
And that's how we're taking that into advantage.
So you're touching on a couple things that I want to elaborate on. Human bias. It's a sensitive topic. And if you have an individual manually reviewing, not only does that person have limited information, but they also have preconceived notions, right? We all do. We're humans. Computers don't necessarily have that. So if through technology we can empower a human with more information, more data, to make a decision that is founded on unbiased data, that's got to remove a lot of risk from a healthcare facility or any facility in any industry to make a convicted decision, a powerful decision, a convicted decision to take action on a threat. Y'all have any stories there or seen that play out with any of your customers?
Well, we see it all the time. Our customers, there's two schools of thought. One is not well educated, and one knows a lot about the technology. The one that's not educated thinks it's reading your thoughts and it's doing all kinds of other things. It's not. It's not the Minority Report. It's not science fiction. It's doing math. It's looking for a person that you told it to look for, and it's finding them or not in a crowd of people, typically. We don't judge. We don't add context. One of the examples I was just telling one of my reps yesterday, I said, imagine you're in Manhattan and there's a building for homeless people that's next door to a YMCA. An individual could be a welcome guest in that homeless facility until they get on their feet and they get where they need to be in life. But they may have fallen and they are now not allowed near children for some period of time. So going into both buildings has different context for the same person. It's not a system to judge. It's the person that's looking at that person saying, yep, you're a guest in the homeless facility, come on in. And at the Y, they're saying, hold on a second, you're not allowed in the pool. You know, you're going to have to wait 3
Sure.
years or whatever it is. So the systems, when they work well, they don't have bias. They don't have bias on color. They don't have bias on gender. They don't have context bias on, you know, how somebody's dressed or what they're wearing or how they might look. And our system has no bias.
That's such an important element in all of this. My brother is a police officer. He's on the SWAT team. He's on the bomb squad. The body cams, the vehicle cams that they have a similar level of intelligence. And I'm thankful for that every day. Because as great of a police officer as he is, he's even better when empowered by more information, more data. He can make better decisions. And then when he does have to take action, he has a lot of backup, right? He has a lot of factual proof to fall back on. And I'm sure any of these facilities in any of these industries are looking for that same type of security.
Absolutely. Think about how many minutes it will take him to identify the person. Let's say that he even knows the person from past, many years ago, bumping. The change of appearance will take long seconds, even minutes for detections. The software will detect it immediately, like fraction of a second.
Wow.
Just tell him that's the person. And that creates some kind of a assessment for him to understand, do I need to act? Do I need to be more responsible? Do I need to be more, take more safety measures? That's what it can provide. But you're right about it leaves him to make the judgment call eventually, right? We just provide that element of quick decision, quick data so you can make a quick
Right.
decision.
You both said the magic word is data.
Yeah.
Because that's all we do. We give people data, right? So it's the security surveillance people that give us information, and we're just giving you back data, right? At this door in this parking garage is this person you told us to look for. Here's the data, right? And then
Yep.
all the protocols and everything else they already do kick into place.
We have this example we gave it. I love this example in the casino that they were detecting a guy that actually gained about 100 pounds over the years. And the software caught him immediately. And the only picture that I have in the system is like years ago. It was like much more thinner and healthy. And he has a beard, he had the hat, he had glasses, and the software caught him. And they said, no way is this person. And the software said, this is the person. They went and checked it out, and it was the person.
Wow.
Right? You can't believe what the software can do, but you need to be responsible in the way you use that. Right?
Sure.
You need to put you apply judgment.
Yeah. Well, I mean, bad actors don't want to be caught.
Yeah.
Right. So of course they're going to have different appearance. It may not be 100 pounds difference, but I bet it's going to be a hat, maybe some glasses, maybe not looking at the camera, maybe trying to blend in with the crowd.
You'd be amazed.
And that's got to be hard for a person, an individual, to manually supervise that. It's great to empower these folks with this kind of technology. You talked about how security's traditionally almost always been a cost. Regulatory and compliance concerns in the healthcare setting is table stakes with anything that they do. And if they don't meet those standards, they're risking closing their doors for good. Talk about how, this type of solution is providing margin so that they can serve their mission, which is helping take care and keep patients really safe, and then be able to render the care that they're in the facility for.
Well, I think Patrick touched on it earlier, but the safer a hospital is, the safer a patient feels, the safer a staff member feels. What is the benefit of that for a hospital? Well, they're going to have more patients, they're going to have more revenue, they're going to have better employees, which is also going to turn into more patients and more revenue. The reputation, all these things combined should make them a better, more profitable hospital. But the soft savings that you don't see, and you never want to see, is what are we saving a hospital that we prevented a major incident at,
Right.
where they had liability issues that could have cost millions and millions of dollars, right? You don't ever want to see that play out, The hospital certainly doesn't.
Right.
But you have to look at those soft costs that they're not tangible. You can't put them on a piece of paper in advance of them, committing to use the solution. But it's huge.
Yeah, it's insurance.
Huge. Yeah,
Well, and a lot of
absolutely.
times you get the call after the fact, right? So you get somebody who got assaulted in the parking garage, and she had given a domestic restraining order to her boss and to HR. So they knew that her ex-husband was on a protection order. And who's liable for that safe work environment when that nurse has asked you to protect her while she's at work?
Right.
So that type of lawsuit, depending on the injury she sustains, the liability falls to the employer, right? So that's one. When you start looking at hiring more guards to do more work that the AI can do in milliseconds, right? That's hard dollar takeout that you don't have to spend, right? So it's cost avoidance, but you don't have to incrementally grow staff where AI can actually give better data faster to your existing staff.
Yep. And I think of the fall protection, quality scores are so important for these facilities. And anytime there's an injury or an infection at one of these facilities, quality scores take a big hit. Why is that important? Not only for the patient acquisition, but also their reimbursement rates are affected. Medicare, Medicaid will not pay a facility at the same level they would if they had better quality scores. The return on investment, visible, invisible, avoidance, increase in patient acquisition, it's almost everything. It can be felt or seen in every part of the business from what I'm understanding.
Yeah, and I think the security professionals are the ones trying to make the case, and the administrators are not connecting the dots. So yes, your quality scores will improve if you have frictionless access control to an emergency room, period. It'll make it safer in the lobby if you can keep that drug dealer from getting access to the guy that he tried to stab, and he's coming in. If you can protect your nurses, then you don't have a reputation of not being a safe place to work, and I don't want to work there.
Yep.
So if the administrators take a look at this holistically, right? We're trying to point out some of these things that people don't typically look at. But if you look at it that way, it becomes a no-brainer.
And the way to influence the administrator is where it hurts, which is money, right?
Yeah.
And
but it's always
if
after
it's,
the fact.
But
They
if they
call
know
us after.
Exactly. But if now they know that if there is, I heard that also one of the biggest topic in assisted living facilities on every year conference, global conference, is falling detections and preventions, detection, prevention. And they were trying many technologies, but that's where you can really talk with the administrations of this. This is where they will trigger the budgets to allow these new technologies, and that's what we saw. And then you can start applying more and more capabilities to not just satisfy the administrator, but satisfy security personnel and provide more safety for the staff of these hospitals.
Yeah, so somebody like NextGen would put this into assisted living facilities, and they would give you data. And that data would say that those patients that are usually taking that walk around every day, the walk is unstable. Now, maybe it's nutrition, maybe it's exercise, maybe it's blood work, but at least you're giving them data that a clinician can take a look at and say, wait a second, something's not right. You're alerting me to it. Let me now put eyes on it and see what we can do about this to maybe prevent some of the falls.
There's also an element that I'm learning from these new industries, patterns recognition. Like there is a lot of similar patterns that happens during the day that if you monitor them and you can understand them, you can actually detect when there's something is off pattern. And that's where you actually create detection. For example, a patient that doesn't need to leave that area of the hospital, and suddenly just she gone somewhere, which is now there is a loss of a patient, right? That's a dangerous area. That's really something that can help compliance and administration a lot.
Yeah, I mean, elopement's a big issue in some of these facilities.
Yeah.
Yep.
Some people shouldn't be walking at all. Some are walking and you can understand the difference in their stride, but some shouldn't be walking at all. But we're stubborn sometimes.
And let's not forget about another important factor when it comes to fall detection, how quickly you respond, right, to the person that fell. Because in a lot of cases with elderly people, they fall, they're not getting their phone, days, and you know it's a problem.
Yeah,
it can be life-saving
for sure.
We also add another dimension to the fall alert. So it's not a simple alert that says someone fall. There is a metadata that attached to that. We actually can identify through the AI the age of the person, the gender, the location, geo, right? What's the cause of the fall? For example, they fall from a bed, or there is a paddle of water. All of these elements are sent with the data, metadata in a very simple view on a mobile device to the security personnel. Think about it, how brilliant it can be for them to get this information and react on time for this event.
You had asked earlier, how do they do it today? You know, a lot of these people are wearing, you know, regulations force them behind 2 locked doors, right? So if you have people with memory care, they're not allowed out. So they're basically in there and they're locked in there, right? If there's a way to protect their dignity and then allow them to walk the grounds and be with people or not, or just get context alerts and data when they're not where they should be, you know, it protects their dignity and gives them a little bit of freedom to have more exercise and to do a little bit more.
Last question. You know, we talked about bias and how that might be an uneducated objection. Another uneducated objection would be around false positives and being alerted too often because of an untrained model or algorithm. How have you seen facilities find success in avoiding these false positives that just turn into noise?
Yeah, they use Oosto. Kidding aside, you know, it's probably the scariest thing in the industry. So if you get it wrong, then you're liable for everything that happens around that. You know, we see a lot of retailers that are hesitant to use technology like this because you misidentify somebody, they get arrested, they get harmed, it's on you, right? So we can't understate how important, and we can't overstate how important it is to do this properly, because you're giving people data and you better be right. It can't be the wrong person, because in some instances, they're going to be confronted with law enforcement or others. And then on the flip side of the same coin, if you give me a lot of noise, I'm not going to adopt your product.
Exactly.
So you spend a whole lot of money on something that no one's going to use. So it's really important to get it right.
We wouldn't been able to exist if we hadn't have this high accuracy, and especially in a casino situation. Like this is the test case, right? For every accurate, they tested tens of solutions, and there is so many solutions in the market that claim to do something. But if you bring false positive or false negative, you're gone. You're done.
I won't be sitting here.
Yeah, exactly.
Their product had a lot of noise.
Yeah, and it's all over the world. You know, we go in and do pilots after people. You know, we're doing one right now in another country where everybody that came forward, big names, all said, we're better than them, we do it better. And we said, listen, you don't have to go to find some tests. Just put it out there. Put it in the real world, in the wild, and actually run it. And then we'll see. And I said, run all the others first, because you're going to find one in there that you're either going to love, or you're going to get to the end of the line, and then you're going to know we're the only ones that do it well. And in most of those cases, customers will always buy us because they've tried all the others and they've seen the noise. Their officers have said, I'll never use that. You know, you got the wrong guy, or that's not who you think it is.
Yep.
And that is the Achilles heel of most of the other vendors in the space.
I've heard the term in the wild a couple times. I can't think of more in the wild than Las Vegas. And there's a lot of competitors. I don't know of another competitor that has 95% market share out there. So you are doing something right.
Yeah.
And that gets me excited about the opportunities in healthcare. I appreciate you guys being here, teaching me and our listeners a little bit about the innovation that's happening in the healthcare space, taking what we learn from other industries and making sure that our patients and our providers are having a better experience. They're having better outcomes. And we're doing it in a way where the mission and margin align. Good luck to y'all.
Thank you, David.
Thank you.
Thank you.